So we're back now for the second part of our conversation on the purchaser perspective. And I'm delighted to welcome our two guests now. First of all, Elizabeth Mitchell. She's president and CEO of the Pacific Business Group on Health. That's a group of large companies that are buying healthcare benefits, providing healthcare benefits, I should say, and buying healthcare on behalf of their employees. She's also the former senior vice president for healthcare and community health transformation at Blue Shield of California. So, Elizabeth, welcome to you. And also with us is Lisa Woods. Lisa is Senior Director of U.S. Healthcare at Walmart, as well as being the chair of the Pacific Business Group on Health. So in effect, she's Elizabeth's board chair running this organization of major companies, again, providing health benefits for their employees and buying healthcare on their behalf. Again, welcome to both of you. Elizabeth, let's start by setting a little bit more context about the members of the Pacific Business Group on Health and what your orientation as an organization have been as you've represented the interest of these employers as purchasers.
Sure. Thank you. And thank you for having me. The Pacific Business Group on Health has actually been working towards its mission for 30 years. We just celebrated our 30-year anniversary. And from the beginning, our role has been to improve quality and improve value in healthcare purchasing. Our members are both public and private purchasers. So we have private companies like Walmart. We also have state governments purchasing on behalf of state employees. So collectively, we spend about $100 billion a year purchasing healthcare for over 15 million Americans. So they are very vested in how do you find and pay for the best care. And I can quote one of our members recently. Her CEO came to her and said, for all of the billions of dollars we're spending, are we buying health? And she said, unfortunately, the answer was no. So we know there are huge opportunities to identify how to get better outcomes, both quality and just overall health outcomes. And we think purchasers are going to lead that change. This was true long before the pandemic. It has only accelerated and become that much more urgent in our current environment. So what might have been a nice to have for some employers is now imperative.
And Lisa, as the board chair of PBGH, you've been involved in a lot of the activities around, for example, directing employees or encouraging employees to go to the best possible providers for given types of care through your Centers of Excellence program, trying to instill changes in maternity care. What to you, as the board chair, have been the most significant aspects of the PBGH activities?
Yeah, it's interesting. Our true north has been quality for several years now. The reason why is because we know it works. We know our costs are less, and PBGH has been absolutely instrumental for Walmart and other employers related to the Employers Centers of Excellence Network, which is a program that they offer. Really, it's a turnkey program that allows employers to be able to offer centers of excellence. That's just one piece. PBGH brings all kinds of information, things that are on the cutting edge. And we're talking about things on a continual basis with employers about what's most important. And Elizabeth, you mentioned health and what health is. It's not necessarily all about dieting and exercise. It's the overall quality of care that individuals receive, the appropriate care. And I think that all turns into the value-based systems that we've tried to create, and then leads to a lot of other, great programs that employers are trying to lead. But I think employers, Elizabeth, and what I see, they are taking a very much larger active role in trying to manage benefits going forward.
And if I could just say, the COE program, the Employer Centers of Excellence Network, is a perfect example. Lisa and her team innovated and brought that innovation to PBGH to share with other employers, because as big as Walmart is and as innovative as they are, We need all of us to sort of go in the same direction. So because we have technical expertise in quality measurement that frankly the plans just didn't offer, we were able to help them identify the best providers. And as Lisa incubated this, we were able to scale it. And that is really sort of what PBGH does best.
So you've had, for example, as part of the Center of Excellence approach, a program where employees for your member companies and organizations who needed joint replacement surgeries could go to the Cleveland Clinic, for example, to have that done, because the Cleveland Clinic had established, obviously, a reputation for providing those surgeries extremely cost effectively. And of course, they also agreed to send people back if they didn't really need the surgery, which you found out happened in a good portion of the time. As we think about the new normal, right, which
Yes.
we're clearly in, as we've been hearing about for the last day and a half, reluctance of employees to travel for all good reasons will probably be a greater and greater reality. How are you thinking about evolving these programs in light
Yeah.
of that, and in light also of the trend to just heightened use of virtual care?
Yeah. So great questions. When COVID came onto the scene, we decided that it was in the best interest for our associates if they did not travel, and then it followed where health systems really couldn't accept patients either. So we have created a program where associates can get care locally, for, the focuses related to spine, hip and knee replacements, cancer, everything really other than transplants. Transplants, we've really asked our associates to continue to go to our centers of excellence. So we're looking at ways to ensure that our associates can get the care in their home communities. Some of the challenges have been that the health systems haven't been ready to take those elective surgeries. And so our associates have struggled to get appointments. So I think anything that the local health systems can do to help support our associates in getting, appointments because they don't feel comfortable in traveling, we're always very appreciative of everything all the health systems do for our associates, but I think that would be, a very positive thing. From a telehealth perspective, we have been very focused on telehealth, and we have felt like that was the future. The beginning of this year, we started a program focused on primary care.
And
And
the we at this point is Walmart, Lisa?
Walmart, along with Doctor on Demand, we've created a pilot in 3 states that's full primary care. So for diabetes, asthma, high blood pressure. So not for the simple sick, right? What we have seen in the past. We continue to look at how does that expand. And in addition to, when COVID started, we said, why can't we pay for telehealth for primary care specialists, psychologists, psychiatrists within the health systems? So we changed our plan so that all telehealth visits that are managed through the health systems are now paid by Walmart. So we feel like that's a really positive change. And I think health systems need to think about how do we evolve the digital technology that's available to us, and specifically related to telehealth, to provide the care and the access that our associates and other employers need for their employees.
Elizabeth, does that attitude or strategy of Walmart's, does that reflect the kinds of things that others of your members are undertaking at this point as well?
Absolutely. Walmart is always out front, and we are always learning from them. But our members are increasingly looking to expand a Centers of Excellence strategy regionally. They have been talking about that for a very long time. COVID is just accelerating that with limits on travel. A regional Centers of Excellence program also can expand to other conditions like maternity or oncology that really aren't suitable for travel. So that's absolutely where we're going. And that's what employers want. That's what they are asking us to help them do. Again, you have to be able to actually identify the highest quality providers. And again, our quality measurement expertise allows that. And what Lisa said about payment innovation, paying for telehealth, our members are truly looking to understand what are the barriers to innovation. Why is healthcare 30 years behind every other industry and technology? Well, part of it has been the payment system, but our employers are also looking to lead and help enable those changes. There is no reason we can't be doing more of this, digitally or remotely. And honestly, I think their leadership may accelerate it even more.
Do you both think that COVID will, in essence, then boost the whole notion of direct contracting between employers as purchasers and health systems?
Well, that's certainly what we're hearing. And I want to say over 20 of our members had already been doing direct contracting on a small scale. That's not new. They were very disappointed with what was available to them on the market. And they knew that, frankly, employers and physicians want the same thing. Healthy patients are healthy employees. It's all the noise in the middle that sometimes makes that so hard to find and access. So they have learned that by identifying and working directly with physicians, they can have really, much better outcomes. And what Lisa's leadership has proven in the COE work is that better care truly does cost less.
Mm-hmm.
So another issue, obviously, that health systems are facing right now, for better or for worse, is that these systems have to a large degree been powered off of commercial payment for elective procedures. And a lot of those elective procedures have gone away. Some are starting to come back in various parts of the country. But there are very few people in health systems who think that these volumes are going to rebound dramatically anytime soon. At the same time, we're seeing obviously major outbreaks occur in places that were not previously as affected by COVID as other places like New York City and New Jersey. As you think about your role as purchasers, you obviously want to get the best quality care at the best cost for your employees. It's also important to keep health systems alive during this period. How are you thinking about walking that line between being supporters of the health system at the same time that you're still holding it to very high standards? Lisa.
Part of what I think about here is there really needs, and we've been saying this for years, that now's the time for all of us to come together. But there really needs to be a partnership that comes from the employers, that come from the health plans and the providers collectively so that we can figure out how to make this work. There's things that I think about here, Susan, that we've talked about for years, and especially Walmart, quality of care, appropriateness of care, that 1/3 of care has been unnecessary. We've gone through this period now where, the unnecessary care, hasn't been managed, right? That we haven't had that. I think there has to be discussions that talk about how do we ensure and continue with the quality of care. How do we ensure that we don't allow unnecessary care to creep back into the system? And the health plans have to work with both groups to try and make this all come together, because the reality is, Elizabeth, you're right. A lot of employers have gone and directly contracted. Part of that was so that we could learn and figure out, how does this work? What's going to work? What's not going to work? But the reality is, when you look at a Walmart, and we have associates all over the country, rural, urban, I can't contract with every provider. And so we need, the health plans and to work with the health plans to try and come to a solution. But it absolutely requires all of us coming to the table with an open mind.
And of course, what we've been hearing over the course of the conference is there's a lot of appetite among health systems to do that. They want to, many of them, get off the treadmill of just trying to fill up their hospitals, trying to keep their surgical, their operating suites filled. They don't want to be these mills of healthcare so much as they want to be forces in the health of populations. As you think about working with health plans to engender more of these relationships that you're describing, Lisa, more of these payment relationships in particular, what would you say would be the most important next one or two or three steps? Elizabeth, let me toss that one to you.
Well, clearly we need a functional health system. Everybody knows that. But to your point, we have been paying for the wrong things. This has been fueled by expensive, tertiary care and elective procedures. I think Don Berwick wrote in JAMA this week that they are really expensive fix-it shops. We haven't paid for the right thing. So one of the areas we are focusing on, as Lisa mentioned, is primary care. How do we keep people healthy and out of the hospitals? That is success. And that means bringing mental health care into primary care. It means actually thinking about the whole person, financial health, mental health, social well-being. And we have not paid for that. Our system does not reflect that. So we also have a problem where, we just had an 11-year bull market. There was plenty of money going into the healthcare system. And they say they wanted to change. That would have been a really good time to do it. Now there is enormous pressure on the people they are asking to pay these bills. Private companies, state governments, we're talking about multi-billion-dollar deficits. The money that they had been relied on to sort of keep everything going, it's not there. So they're going to be forced to innovate much more rapidly than they might have anticipated, because you can't sustain a bloated, inefficient system in this environment.
Well, and that's a good juncture to come back to you, Lisa, because Walmart, obviously, in addition to being an employer, worried about and concerned about and trying to buy the best possible care for your associates, you're also moving into the provider space in terms of the in-store clinics and other avenues. How do you see Walmart's role evolving in this new normal?
Yeah, I think this is a place where we are focused, obviously, on healthcare, and it is going to continue to be an area that we focus on. You mentioned clinics. That is a good example where we're opening primary care clinics that have vision centers, pharmacy, dental, all under one roof. And some really good things are coming out of that type of model. But we're also looking at things like offering testing right now with COVID. And it's available at test sites at the stores. It's within 31 states now. I think you're going to continue to see things evolve within the pharmacy area, and focused on, vaccines and immunizations, which we already do today, but we'll continue to do that. So yes, you can absolutely look to Walmart to continue to focus on healthcare.
And I just want to say, the fact that Walmart has to build a primary care foundation, it just really says something about the system. Thank goodness they're doing it, and they're doing it really well. But the healthcare system didn't fix itself, so employers are going to step in and fill that gap.
Well, it's an exciting time. It's a nerve-wracking time, I know. And I know also, given Walmart's desire to look at the well-being of its associates broadly, these kinds of concerns are going to be more real than ever. And I want to thank both of you, Elizabeth Mitchell and Lisa Woods, for a terrific conversation. Best of luck in your future work. Thank you so much.
Thank you.